Okay, let's end with a blast. Well, it's not quite the end.
Yeah, I
Or
got one to go.
from the end. But these last two papers are actually, you hung in there, and now we get to some that are
A
kind
little
of
reward.
interesting and fun. So this one is on blast injuries. It's by Wolf et al. It's in the Lancet 2009 paper.
Yep.
And it's not at all surprising that blast injuries are something that's been thrown into our
World.
bit of things that we need to know about. Because we know that explosions can be industrial accidents or household accidents, but it's the terrorist actions that have sort of put this into the forefront of what we're all worried about.
But I would point out that there are some things that we don't think of as blast injuries that really are. So when an airbag goes off in your car, that's an explosion that causes that. So if your eardrum pops, and occasionally that happens when an airbag goes off, that's a type 1 blast injury. If you have corneal abrasions from the dust, that's a type 2.
Right.
If you have burns, abrasions on your forearm from the bag coming out like shrapnel and scraping them, that's the forearm abrasion rather is a type 3, and burns or inhalational injuries, asthma attacks are type 4.
Absolutely.
So just airbag injuries. Now we see less of those because airbags have gotten better. We're on our third or fourth generation of airbags, so you see a lot less of this. But they represent a common blast injury that people don't think of that way. Mm-hmm. If you keep that in mind when you do this article, you'll start recognizing that you're seeing blast and barotrauma injuries that you didn't recognize before.
Right, and I kind of like, Billy and I were just both talking about this. We both really like this paper because it kind of put things in a form that makes some sense with blast injuries. So I think this is kind of neat.
And there's new stuff.
Then there is new stuff. So if something happens that's terrible, blast, be it one of the local refineries near where I work that explodes, or something like the Oklahoma City bombing occurs, emergency personnel are going to get involved. So you have to know what blast injuries are and what they do. The physics of explosions, basically, you take something solid or liquid and you turn it into a gas really fast. And when it becomes a gas, it expands outward really, really quickly and has to displace everything around it, be it you, the things inside of you, the things around you. Everything has to be displaced.
So there's an enormous expanding pressure wave
really
radiating out.
Fast. It causes an immediate rise in the pressure that over time and distance will dissipate. And that's actually very important. The distance part of this is really important. And of course, over time, it will dissipate as well. And depending how big this thing is, it can generate enormous winds. Things like a nuclear explosion, huge winds can get generated with these. So because of the power involved in this, it can throw things all over the place. People, objects, you name it, can get kind of, as part of this physics, can get thrown around. So what it does is leads to certain kinds of potential injuries. For instance, water, explosions in water, what it has to then displace is water, and it has a potential greater injury because of just the density of water than does air. So there's a potential for greater injury. If you happen to be underwater when an explosion occurs, you may be injured much more than if you happen to be out.
Despite the movies where these happen all the time and they just sort of shake their head and
do.
they're fine. No, they'd be
Yes.
dead meat.
Absolutely. Now, and also, you in general would like to be further away from an explosion. You don't want to be right next to it or wearing the vest. You would like to be as far away from possible, although still things can happen at a distance. And you also would like to be away from something solid. You don't want anything that can fall on you. So if you happen to be at a scene or people are brought in from a scene, you want to know things like how far were they from the area of explosion? Were they near a solid wall or of some sort? Were they in water, near water? That will give you some idea of the kind of injuries that you may have. And then explosives come in sort of various varieties. They're low or high order, and what it's based on is how quickly it detonates. So low order, it burns really fast, and it produces a whole lot of volume of gas, but it only will explode if it's inside something contained. So pipe bombs. So you light it, the thing just bursts. But if there's nothing around it to really go anywhere for any length of time, it doesn't do much by itself.
It's called fireworks.
Yeah, fireworks basically are low order explosives. High order, they don't really burn. What they do is they detonate when you pass something through the material. It's either friction or heat, or it needs to have a true incendiary device, something that actually will first explode and then it explodes. So you have sort of two levels of this, and the high orders are the really more dangerous as far as having more potential impact. The other ways you can make things more lethal, or things we saw this in Atlanta, is you can put things in what you're exploding. So ball bearings, pieces of scrap metal, rocks, etc. IEDs have a lot of this sort of thing in them. And then if they're really evil, nasty, horrible, they can put feces in there or some sort of toxin that if you happen to get pierced by the stuff that you've thrown in there, you now have an increased risk of infection later.
So a corpsman that we've both worked with at a little company, Mary, we knew him back then as Lenny, but he's now a lieutenant commander and just got back from Afghanistan.
Oh,
He
I
was
know.
describing some of the stuff that they saw. And they saw explosives packed not just with nails, but with rat poison, carcasses of dead animals to make sure they were infective, and just horrible stuff.
Yeah, ridiculous. So so if you were interested, you could do all kinds of things to increase the lethality. Now, blast injuries, Billy was talking about these sort of types of injuries, and they're basically primary through quaternary, actually, patterns of explosive injury. So the primary explosive injury is that initially that blast occurs, all that air is displaced or water is displaced, that overpressure reaches you and all of your interfaces. So your lungs, your brain, your eardrums, all those interfaces have this sudden change in pressure. So water to solid, air to water, air to solid, all of those interfaces are the problem.
Right, so your TMs can rupture, you can drop a lung.
Your gut can rupture,
Yeah.
you can end up causing your alveoli to rupture, air embolism, shearing injuries. Those are you are near the displacement of air or water. And
So
that's
type 1 is blast wave.
blast wave is type 1. The secondary blast injuries basically are the shrapnel.
Yep.
So the things that get thrown by that blast, or the winds that throw things around. And this is penetrating or blunt trauma. And what's interesting about this is this can occur at a great distance from the initial blast. So somebody could be a block away.
Which is why they often set up a pre-explosion. So they, for example, in
Everybody
urban
runs to
areas,
it.
they've set up an explosion near a bunch of tall buildings, and everyone comes to the windows to look out and see what it was. Then when the real explosions goes, all those windows are going into their faces,
Right,
rupturing
so
their
that's-
globes.
Right, and so there's the
lacerating their
actual
face.
flying debris that occurs. And again, this can be far away. And these are way more common than, because you have to be near the primary, the blast itself to get the primary injury. These can happen at a distance, so they're much, much more common. These are the secondary blast injuries, which are shrapnel, basically, penetrating usually. Tertiary is when you are physically, all of you, are physically displaced. You are picked up and thrown somewhere. And this is the blunt injuries. This is just like, driving your car into a wall or jumping off a building. So you have head injuries, abdominal injuries, contusions, fractures, and you can also get crushed if you happen to be near a wall and you're thrown into that, or the wall collapses on you. Those are tertiary
Now,
blast
it's kind of
injuries.
interesting with the tertiary because, you have a perfect movie image
Yeah, it
here.
is.
In the movies and in Hollywood, people are always getting picked up and chucked by explosions. In fact, sort of the less glorious truth of the matter is the people who are too close, they're not picked up and thrown anywhere.
No,
they're
they're
vaporized.
incinerated,
They're just a pink blur on the wall. And the people who are a little further away aren't picked up. They might be knocked to the ground, but that's it. And it's pretty rare for the explosion and the
To take
vectors
you
and
intact
and stuff.
just throw you.
Even though every
Yeah.
explosion in Hollywood has some stunt guy flying over the barrels
With
or
all of
do
his
something
parts
with all of his
intact,
parts
usually.
attached to him,
Which isn't
Yeah.
real life.
Actually, the people who are closer, the ones who aren't vaporized, the ones who are just a little bit further away, actually have their extremities ripped off by the blast wave.
Right. And a little further, their shoes stay in place, and they will
They
go.
go. Yep.
Yeah. So quaternary is sort of the next level, where this is anything that doesn't fall into those first three categories: the immediate blast, the shrapnel, or the getting thrown. And this is things like radiation or carbon monoxide or cyanide, or one would think even infections, et cetera. And then the quaternary are basically a delayed. And this is something that's come more recently as we've had more exposure to some of these
Yeah.
IEDs, et cetera,
Yeah.
where there are inflammatory states from being near a blast. And it's not exactly clear what's going on with these things, but they get a positive fluid balance,
They get a
low
fever,
blood pressure.
they get-
It's an unclear,
Like a SIRS syndrome
Right.
that has nothing to do with infection. It has to being whacked by a blast
right?
wave.
Exactly.
Yep.
So. If you get to the blast injuries themselves, the injuries patterns and management for us. So those primary blast injuries, I'm too close to it, and I get the wave hits me. It's usually those interfaces. So pulmonary, GI, and auditory systems are most susceptible. It makes total sense. And the ear is what goes first. It's way more common than the other two. You can have brain problems, vision problems, et cetera. You can even have a global response where you basically go into shock from this. That you tend to recover from. But this is all from that primary blast injury itself. The pulmonary system is also at great risk here. You can drop a lung, you can get pulmonary hemorrhage, pulmonary contusions, subacute air, or the bad thing, which is the arterial air embolism,
air
just like a
embolus.
diver.
Yep.
So it's the same problem with that. And most of the people, if you can keep them alive long enough to get to the hospital, we are pretty good at taking care of these people.
And it's sort of, there's a lot of serendipity about this. Which direction were you facing? Were you full face towards the
Right, then
blast?
you get-
Was it your shoulder that was facing? even things like, was your mouth open at the time that the blast wave reached you, can increase transmission and increase the likelihood of pneumothorax. So just for those of you out there who are dangling mandible breathers, it's just one more
Close your
reason
mouth.
to close your mouth.
Now, there's a thing called blast lung syndrome, which is just basically that whole pressure wave going through you can cause dyspnea, cough, and hypoxia. And it looks basically like almost like pulmonary edema, non-cardiogenic pulmonary edema. You can get fistulas, et cetera. And then air embolism is exactly like you'd see in a diaper. So they can get stroke. Wherever that clot goes causes trouble. Stroke and MI, they can infarct
Wherever
the
that bubble
intestine.
goes,
That bubble goes. So spinal infarction, you name it. So this chest x-ray on this slide basically shows non-cardiogenic pulmonary edema. And
Normal
in the
heart size.
differential of that, which includes things like altitude illness, and it's actually, think of it sort of like that, is you basically get just leakage into your alveoli.
And notice in particularly the right base is actually relatively clear.
Right.
Yeah, so it's sort of more upper than lower.
So one of the things that's sort of a take home on a management status is if somebody was near a blast, particularly say they have their eardrum blown out, they were close enough to have their eardrum blown out, that's somebody you may want to keep around the ER, even if their first chest x-ray is normal, for 6 to 8 hours to see if they actually develop this blast lung problem that occurs. And that to me is a potential both management in real life and a potential question here on what to do with somebody like this.
So the TM stuff comes up, and I know the authors here said that the TM correlates pretty well. The TM means that you've been in a blast injury, but the literature actually on the topic in terms of how well it correlates, for example, with pulmonary injuries and other injuries, is a lot more mixed than you might get on a first read here.
Right.
So it's a little bit messier than that.
It is. It doesn't mean you're going to get it, but
Right.
it does mean you were close enough to have an injury.
Right. It means be alert, but it doesn't. Having a TM down, for example, doesn't accurately predict who will have things like blast GI, blast lung.
No, but it does. But I think you do know that you'll be a
You know
little
that
more
that's a mechanism,
worried
right.
in that person.
No doubt.
As
No
a
doubt.
mechanism.
No doubt.
As far as just treating that, you're going to treat whatever the injury is. But one of the things they do recommend, and I find this a little bit odd, is non-invasive ventilation.
Yep.
If you have a leak, like a bronchopulmonary fistula, or if you have an air embolism, I'm just not sure this is all that great
But
of
they've
an
been
idea.
going that way with ARDS
Yeah,
too.
no, it's true.
have
Well,
been.
for blast
Trial
lung,
of it-
for blast
tri-
lung,
yeah.
but that's not for a dropped lung. So this isn't
Oh,
something I
yeah,
would
yeah,
use.
yeah.
This isn't routine. This is mainly for the blast lung kind of problem.
Correct.
And then chest tubes is appropriate, et cetera, for treating hemothoraces, pneumothoraces, and anybody who flies.
Right, because even if you have sort of a sea level pressurized cabin, it's still a little bit dicey. Obviously, if it's a sea level pressurized cabin, they ought to be able to fly, but otherwise you're worried about their air-filled spaces expanding.
Right. Positive pressure ventilation can take that barotrauma and make it worse. You know that. So just be careful. And if you do need to intubate them, what they recommend in most cases, not all, is to go ahead and accept things like a low sat, low tidal volumes, pressure controlled ventilation if you can, and permissive hypercapnia, especially in the blast lung,
Yep.
which is sort of the ARDS approach, which we'll actually hear a little bit about more later. Now, air embolism is a totally different story. They now have stroke symptoms, or they're paraplegic because it went to their spinal cord, or they have gut ischemia. This person needs to basically get hyperbaric oxygen therapy. It really is the treatment of choice, even as long as 60 hours out. So,
Because a lot of times they have surrounding circulatory support. So, in other words, they have a partial SMA occlusion, a distal branch. They might have enough penumbra of flow from their IMA or from others, so that even late you ought to, if it's going to take you a couple days to get to a chamber, or it's not considered for a couple of days, you still ought to try it.
Now, your GI system is the other place that the blast injuries that itself will get you. And the places that are at most risk are the colon, which is the bigger air-filled sac, and then the ileocecal region, which is kind of a pin-down transition point.
Yeah.
They're the highest risk of perforation. And of course, because it ruptures your gut and it can take a little while for you to develop symptoms, they can have a delayed presentation. This is what you get if you are in a room and things explode. So there's only so much place for that blast to go, or you're underwater, or you're getting hit now with the water and air being displaced. So you can have the gut sheared off completely, or you can have the gut rupture. And this is as high as 1 in 4 or so
And
people.
your film shows that free air.
The free air under the diaphragm. You resuscitate, do a fast to make sure there's no fluid as well in there. So check fast, CT if it's indicated, and watch them. One of the take-homes on blast injuries is anybody who may have been really near the actual explosion itself, just keep them around for 6 to 8 hours and just make sure that they're okay.
Right, because the belly pain may develop late. Their ARDS may take some time to develop. And the other thing they do say about them, yes, I agree with you, resuscitate, but one of the emphasis, particularly because blast lung might come up, watch
Your
don't
fluids.
overdo it on the fluids, because if you just dump 2 liters in or 3 liters and they were euvolemic, then you may actually be making your pulmonary management
Right, and most
more
of them
difficulty.
are euvolemic. So as
Yeah.
long as, yes, exactly. Now, we talked about the TMs, and it's
Yeah.
the most commonly, because that's open to space everywhere. So it's the most commonly injured area.
I protect mine with wax.
Oh, and you do a good job at that, actually. So they say that you can use an intact TM as a minimal risk of blast injury. And actually, I think that is true. I'm just not sure
Yeah.
that if you have the rupture,
It doesn't mean you have bad
yes.
things.
So I think
I
no
agree.
TM rupture, you're much less likely to have any of the other blast type injuries.
It is messy literature, though, and a
Yeah,
lot of
it's
this comes from places like Israel and other places. So it is, and I certainly don't claim to be an expert on it, but I've looked at a bunch of those papers, 4 or 5 of them anyway, and there's, it's all over the dartboard.
Now, your hearing is not just rupturing an eardrum. You can blast your ossicles and disrupt them and end up needing to be surgically repaired for hearing deficits. You can have, and this is quite common, people near a blast will be temporarily deaf over hours to days. They'll have tinnitus or deafness that will slowly come back over hours to days. You can rupture your perilimb fistulas just like if you're diving. It's the same kind of concept, actually. It's a pressure problem.
Yep.
You can get vertigo and dizziness. And most of these will heal unless they're big. So big TM ruptures need to be fixed. Your CNS absolutely can be affected. PTSD and concussions or shell shock is something that was described back multiple wars ago. First World War was a big description of this. It can be both primary, secondary, or tertiary blast injuries that can affect your CNS. You can have something go through your head from a shrapnel. You can have a building fall on you. You can get thrown and hit your head, or the blast itself can do it. You have a lot of reasons that blasts hurt your head. Now, your musculoskeletal system can be also affected by any of the 3, primary, secondary, or tertiary. Things flowing through the air, you get thrown into something, or the blast hits you. Basically, most of these are combat injuries. The IEDs will do this, and it's just devastating. It's devastating. But one of the things to know is the obvious injury is obvious. Something went through that limb. It can occur in also apparently uninjured limbs. For instance, compartment syndrome, where they're getting increased pressure within the compartment, can be just the blast-caused disruption within this closed, what looks like a normal calf. But now, because they're having leakage of fluid or bleeding within the calf, they can end up with compartment syndrome. So it may look fine on the outside, but if they have pain out of proportion, worry about compartment syndrome in people that are related to blast injuries.
And obviously the fasciotomies, you want to do them before there's ischemic permanent.
Right, and if
You gotta
there's pulse
loosen those up.
deficits, you're in trouble because you're way down the line then. Now, musculoskeletal system, if you things blow off as part of blast injuries, as parts can get blown off. It can be partial or complete, but I'll tell you, it's one of the reasons people die. It's one of the biggest reasons people die related to blast injuries is just parts are blown off.
And the whole military effort, when we look at the IED things, is one, obviously protect them from them with the appropriate vehicles and things, but tourniquets are in, and they do these huge resuscitations on them. They just keep them from bleeding to death.
Right, exactly. Now, your eyes can be ruptured. Your eyes are 10% will have some sort of eye something, be anything from as minor as an abrasion to as huge as a ruptured globe. And burns are really, really common. A lot of these are explosive and burn. So burns are often complicating things like crush injuries, et cetera. So these go, and you treat it like any other burn. Okay, aggressive resuscitation as needed, and if you have lungs that are filling up, you're going to have to sort of walk the line and keep them hydrated and yet still keep them oxygenated, often with intubating, considering albumin in some of the cases. So to just summarize blast injuries, they are more common for lots of different reasons. Take it anything from the airbag to terrorist acts to industrial accidents. The primary injury is the blast itself. Secondary is the projectile. Third is something blunt. Quaternary is things like radiation and other things, and there is a quinary, which is the sort of one strange systemic thing.
Yep. And a lot of these happen, a lot of blast injuries, when you talk about industrial stuff, they happen in sort of what seems like a predictable environment. But sometimes they surprise you. So one of the bad ones that we saw a few years back was when somebody was in, bananas come from Central America to Los Angeles unripe. And they put them in ripening fume hoods, which are basically methane filled. And so, this guy just thinks he's working in a warehouse. They got him in there cleaning up, so he's sweeping up the floors and doing stuff, and it's like, I'll have a break. And he lights up. So if the methane fume hoods aren't air, so that thing just exploded. We had a company in Los Angeles that makes caps, for the little cap guns. Well, to put that, you have to have the thing that puts the red paper together, and it's drawing gunpowder out of this container. That blew up. So you'll see these things. I remember a guy we saw who was squeegeeing out the thick oil sludge at the bottom of one of those
Oh,
huge
yeah.
circular
I've
things.
seen one of those.
It was all empty, and he was down there working hard, and he also decided he needed a cigarette break. That
not
didn't
good.
go so well.
Not good. Not good.
Yeah.
Not good. So the blast injuries, air tissue interface is what you worry about. So be careful with those.